Lumbar spinal stenosis. Imagine every step feeling like a gamble. Will your legs give out or will the pain just keep building? Lumbar stenosis isn't just a problem for today, it's a condition that could shadow you for decades. And here's the big question no one's answering. What really happens if you treat it and what happens if you don't? Stick with me because in the next few minutes, I'll reveal the long-term truth backed by science and real stories so you can stop guessing and start knowing what to expect. Will it worsen every year? Can you avoid surgery forever? Most videos dodge these questions, but I won't. I've dug into the data and I've worked with people living with lumbar stenosis. By the end, you'll see exactly how lumbar stenosis unfolds over 5, 10, even 20 years and what you can do about it today. Let's get started. I'm Dr. John Zlonka, a neurofunctional chiropractor in Ottawa, Ontario, Canada, and past director of rehabilitation at the Ottawa Sports Science Center. If you have lumbar stenosis, it's like the hallway in your lower spine is slowly narrowing. Things like herniated discs, misaligned vertebrae, and arthritis can crowd that space, pressing on the nerves and the spinal cord. Stenosis means narrowing. So what does that feel like? Well, maybe your legs cramp if you stand too long. Maybe you get tingling all the way down to your toes. Some days your legs will feel weak, or you trip more often than usual because your balance is off. Sound familiar? That's lumbar spinal stenosis, and it doesn't just cause pain, it makes everyday life harder. Walking to your car, cooking dinner, even going for a simple walk. Suddenly, these are all struggles. It's not just discomfort, it's your freedom being taken away one step at a time. You might be thinking, I'll tough it out. Totally understandable. No one wants to deal with this. But here's the reality. Leaving it alone just gives it more time to get worse. Fast forward 5 years, that stiffness and pain could get worse. Simple things like shopping or gardening, now they wear you out. Give it 10 years and it might become chronic, persistent pain, weaker muscles, and possibly issues with your bladder or bowels if the nerves are seriously compressed. In 20 years, a walker might not be optional anymore. You could be relying on it just to help get you around. But here's the scary part. Spinal nerves don't bounce back easily after long-term pressure. Permanent nerve damage, balance problems, loss of independence, even depression and other mental health issues. There are real risks of waiting too long. Now let's flip the script. Catching it early and doing something about it can make a huge difference. Start with physical therapy. Simple exercises to strengthen your core and stretch the spine can reduce the pressure. Pain meds or anti-inflammatories might help take the edge off. Obviously, I prefer the natural supplements that we provide our patients and are very effective. And even small habits like improving your posture or staying active can add up. If the stenosis is more advanced, surgery is an option, but there certainly are risks and complications and prolonged recovery times. Procedures like decompression surgery can take the pressure off, or spinal fusion can help stabilize the area. Again, not my first choice. Early surgical treatment can sometimes lead to faster and more complete recovery, especially when the nerves haven't been damaged too long. What actually works? Let's talk numbers. Surgical decompression, such as a laminectomy, where they'll actually cut away the bone, part of the bone of the vertebrae, helps about 70 to 90% of people with symptom relief. That said, it's not always permanent. Some folks need a second surgery down the line, which just brings more risks and complications. Physical therapy is usually the first go-to for a lot of people. In fact, a clinical study showed that people who got hands-on therapy and personalized exercises improved significantly more than those who only took meds or did generic group classes. Then there's non-surgical spinal decompression therapy, and this one's really gaining popularity. Some clinics report success rates anywhere from 71 to 89%. In our clinic, we've seen a 90% plus success rate with a specialized form of this treatment. Here at our health center, we offer non-surgical spinal decompression for people dealing with lumbar stenosis or chronic low back pain. It's safe, non-invasive, and for many patients, a real alternative to surgery. People often notice major improvements in pain, movement, and overall quality of life, but we've taken things even further. We now use a new cutting-edge treatment called non-surgical robotic laser spinal decompression. There are only 12 clinics worldwide that have access to this technology, and we're proud to be the only one right here in Ottawa. This therapy combines two powerful treatments at the same time. Class 4 deep tissue laser therapy applied directly to the area of stenosis to reduce pain, ease inflammation, and relax tight muscles while doing non-surgical spinal decompression, which gently decompresses the spine to relieve pressure on the nerves and the discs. The two work hand in hand. By treating both the nerve compression and the surrounding muscle tension simultaneously, we're giving our patients a much more complete solution. It's advanced focused care, and it's making a real difference. Take Jeremy, for example. Jeremy, 29 years old. So understand, spinal stenosis doesn't just hit people in their 60s and 70s and 80s. One of the hallmarks marks you'll see will be those people who are leaning forward on their shopping carts, because that tends to take some pressure off the spine and tries to open it up. Jeremy, 29-year-old, terrible back pain, affected work, affected everything he was doing. Luckily, he had an employer who at least, gave him some compensation and so forth, and some allowances that he was able to continue to work, but it was not great. Jeremy, spinal stenosis in addition to disc herniations and degenerative disc disease, and his pain was so bad that he was ready to go to Germany and spend $65,000 on surgery. And one of the things that stopped him, and when I say ready to go, he had already sent the MRIs, he'd already done the pre-exams and so forth. They told him it would be 3 months recovery, and after 3 months, he might be able to drive at that point in time. But what really stopped him was when they told him, they strongly recommended that he donate to a sperm bank before having the surgery done. Because again, understand, we've talked about how those same nerves that exit the lower back go down the legs. They affect your walk, and they affect all the things we're talking about. They also go to the bowel and the bladder. They also go to the reproductive organs. So in Jeremy's case, there was a 4% chance that Jeremy would never be able to father a child again, because they would actually affect those nerves that go to the reproductive organs. That's when Jeremy came to us instead. We're pleased to say, after going through one of our comprehensive programs with the non-surgical robotic laser spinal decompression, Jeremy is back to living life, and especially, as someone who is only 29 years of age. So please, Jeremy is living proof that this approach works. And it's exactly why I'm sharing it with you now. And particularly in Jeremy's case, we were able to see pre and post MRIs that literally showed an improvement in the stenosis, in addition to all the benefits, and Jeremy returning back to his normal life again. So obviously, surgery is not the only option. If conservative care, like therapy, exercises, or non-surgical spinal decompression, is helping you stay stable and active, surgery is not needed. That's what happened with Jeremy. But if you're losing function, especially if you've let it to progress to loss of bowel or bladder control, then surgery isn't just an option, it is necessary. Always talk through your options with your doctor, and try to have a doc who understands these conditions well. Here's what I've seen. People who take action early are often in better shape than those who don't. I've seen it with my own patients. It's not just how old you are or how bad the condition is. It's about how long you let it run the show. One long-term study found that both surgical and non-surgical patients had actually similar satisfaction years later, but the ones who acted early had fewer problems and better long-term results. Bottom line, you don't have to stay stuck, and you definitely don't have to go it alone. You now have a thorough analysis of lumbar spinal stenosis, what it is, how it progresses, and what you can expect from different treatment options. Unless you're dealing with urgent medical issues like loss of bladder or bowel control, give non-surgical robotic laser spinal decompression a try. It could be the very breakthrough that your spine has been waiting for, the kind of relief that gets you back to walking, sleeping, and living again. If you found value in this video, please like and share it. Leave a comment and tell me what you're going through and how things have turned out. I read everyone, and I want to know. Be sure to subscribe if you want to stay ahead of your spine health and learn real research-backed ways to relieve pain without surgery. Now, if you're ready to start relieving pain in your back and legs from lumbar stenosis, I've got the next best video for you. It's right here, and it walks you through simple at-home exercises that are easy to do and designed to take pressure off your spine. Go watch this video next.